Yes, it's Dr. Buford. I'm here with the rest of the shoulder team. We're just getting started on the left shoulder. We're looking in from the back to the front. We examined your shoulder when we started, and sure enough, it was very unstable. It would dislocate to the front with very minimal force, and it would even slide out posteriorly as well. So now we're getting our first look inside. We've got two cannulas coming through the front through a part of the shoulder we call the rotator interval. This is the gray plastic cannula on the left and a metal cannula on the right. If I come over here, you'll see the biceps tendon running up between 6 and 12 o'clock on the screen. Above that, here is the rotator cuff, which looks just fine. No signs of any problems with the rotator cuff. And for the rest of the examination, we're going to put the camera in the front. But just before we do that, I'll show you down the front of the shoulder here. Here's the anterior labrum. And although it's attached, it's just loose. There's a band of the anterior band of the inferior glenohumeral ligament. Again, it's just loose. We're going to tighten it up. As we look towards the back of the shoulder, we're going to see something very similar, where the capsule is intact, but it just needs to be tightened. So we're going to go off on the video for just a minute. Okay, we're just going to make a stitch in the back. You can see the suture hook. We're going to rotate here. It's a little bit hard to push through the capsule because it's so spongy. There you can see it's coming through there. And then we'll reach underneath the labrum and see if we can't capture some of that in just a minute here. Like that. We'll go ahead and feed the relay. Pause, please. In the back, I'm happy with that. Now we're going to get to work in the front. See how that tightens things up back there? Now we're going to work on this side. Pause, please. Okay, so now we're working in the front of the shoulder. And the first step is to use this instrument that has these sharp ridges on it. See these little points, little mountains? This is a rasp, and what it does is it helps us to roughen up the capsule and the ligaments so we can get a good healing response. So this is really what we're going to focus on next, is this anterior band of this inferior glenohumeral ligament. So we're just dragging the rasp across it just to make it sticky. We're trying to make it like a piece of Velcro. And then we'll back up and roughen up the capsule here as well. Okay, and so the next step is to look at the labrum, make sure that we don't need a suture anchor. That's going to be okay. So we'll go ahead and take a suture hook, which would be what we call a turn to the left suture hook. And we'll start here. Okay, pause please. Okay, now we're making our second pass through this ligament. Not sure. Okay, so now we've got a knot here. or not to tie rather, we've got the suture passed using that same kind of figure 8 technique. So next we'll take a mosquito and a picture. So if you watch here, we'll show you how this really tightens things up nicely. Snugging that knot down there. Last one, and then we're going to cut the suture tails. Okay, so good. So now we've got that tied. We're going to tie one more, or place one more suture. I'm happy with what that's done. We're going to do one more just above it. Follow and turn to the left. Okay, so now we're ready to tie another knot. Okay, so now we're going to cut the sutures there. And we'll have a look. Hold this right here. See the shape. So as we look down here now, I'm very happy with the way that looks. That looks a lot tighter than when we started. Back up on the grade just a little bit. Okay, you can pull it out. So we're going to finish up here and get you back to the recovery room in just a few minutes. Hopefully that'll help balance the joint and give you some stability. So good luck to you now. Bye-bye.